Hello, are you wondering what functional medicine is? How can it help you? What treatments are involved? How do we diagnose? And what we even do? This is the video for you. If we haven't met yet, I'm Dr. Alison DiBarto Goggin with Little Black Bag Medicine. I am a functional medicine physician and a doTERRA wellness advocate. And today we are going to be talking about what is functional medicine and give you a really good overview. So if you've ever been sick or had a problem, maybe you didn't know what was going on, and then you went to your primary and then they referred you to maybe a GI or a rheumatologist and then to a dermatologist, and all of a sudden you were seeing a bunch of different doctors and maybe they all told you something different, or you came home and you have a prescription for each individual issue, but maybe nothing seems to be getting better, then functional medicine might be a great solution for you. Okay, so functional medicine is a term that encompasses that doctors, nurse practitioners, a lot of health coaches do this as well, that look at the body as a whole. So instead of looking at each individual system, like a GI just looks at your gastrointestinal system, a rheumatologist looks at your joints, dermatologist is just skin, we look at the body as a whole because we know that one system will always affect another system. Nothing is independent of each other. So there's always something at the root cause of this. So typically my patients come to me when they have multiple issues, which is completely normal. A lot of people will say, oh my gosh, I have so many things going on. My hair is falling out. I can't lose weight. I have anxiety. I have insomnia. I have this really weird rash here. I don't know what to do. I've seen all these doctors. And that's great because what we do is we look for that underlying issue. So that's really common. So typically what I have my patients do is, of course, we fill out your whole health history. We want to know exactly what's going on with you. We also fill out a symptom survey, which has a list of symptoms, and a brain health survey, so we understand what's going on with the brain as well. So for a classic patient like this, usually what we do is run labs, so we know if there's anything major going on. We want to look at thyroid panels, immune system, liver panels, kidneys, blood sugar, everything. And then based off of what that individual person needs, we'll also do additional testing. So maybe we need to run a hormone panel. Maybe we need to do a stool test for the GI system. Maybe we need to do a nutritional test, depending on what's going on. So everything's definitely personalized and individualized based off of what you need. And then we do, for my practice, I do about a 90-day plan on your lifestyle, your food, your nutrition, your supplements, your exercise, everything that you need so you understand where to go. So for someone like that patient that I just described, run the blood work, probably run a hormone panel. Usually if they have IBS or skin issues as well, we run a stool panel because those are intimately connected. And then based off of that 90-day plan, we might need to change up their food and their nutrition, what they're eating, supplements to help support neurotransmitters and sleep. Hair falling out, honestly, we have to look at thyroid, we have to look at anemia, we have to look at autoimmune issues. There's a lot of things to look at. So in functional medicine, we're able to see this really, really big picture and bring it all together and find those deeper underlying causes. Now, what's frustrating for most people is that they will message me and say, okay, Alison, what's your protocol for migraines? What's your protocol for fibromyalgia? And honestly, in functional medicine, we don't really have protocols. You can get all the books, I have them too, about what to do for what, right? But because everything is so individualized, everybody suffers from similar symptoms, but it might be for different reasons. A classic one would be like rheumatoid arthritis. It could be joint destruction, obviously, from the immune system. It could also be bacterial infections or viral infections. It could be lupus. It could be a number of different things. So we want to figure out exactly what's causing that. A lot of times with IBS, a lot of people will just take their supplements and nothing ever changes. So we have to figure out, is there an infection? Is there parasites? How's the immune system doing? Is it functioning? What else do we look for? How about hormones also affect IBS? Do you have an autoimmune disease like Crohn's or colitis? And then if you're not getting better, is there something going on with the brain and the enteric nervous system? So do we need more connection there? Do we need more support in the vagus nerve? And maybe that will help you get through things a little bit better. So there's always a connection. There's always something to be explored, which is really neat. Let me look. I have a couple notes here because this was my podcast for this week, and I recorded it and the whole thing came up blank. Could you believe that? So I'm like, I guess I'll just go live and share all this information with you. So, my favorite tests that I like to use, of course, we do basic blood testing. We look at blood sugar, glucose, hemoglobin, A1C, like I said, full iron panels, full thyroid panels, full immune panels. What I love about my practice is that you can bring things to me and say, hey, Alison, I want to run this, and we'll get it done. Your insurance may or may not pay for it, but I use a physician's co-op, which gets your blood work for a lot cheaper. So for $100, you can get a full panel rather than submitting it to your insurance. And sometimes people get $1,000 bills back. So I like to avoid the whole thing, use a co-op, make it really cheap. And it also takes out that guessing as well. A lot of times you might hear, hey, my doctor won't run this test because they don't think it's valuable. Honestly, all information is valuable, and I run all of those tests on myself because a lot of times I've thought there was a specific issue, and sometimes I was right, and sometimes I got relief because that wasn't the issue. So it's good to know. The other tests I like to use, I have 2 hormone tests, usually the Dutch test, which is a urine test for hormones, and then a saliva test from Genova Diagnostics for hormones. Both of them will give you cortisol mapping as well, so you see how your stress hormones are doing out throughout the day, your melatonin throughout the day as well. I also like to use the GI map from Diagnostic Solutions. It's a stool test. It's not sexy to talk about, I know that, but honestly, the tests get shipped to you. You do the test at home, you ship it right back to the lab. And what I love about this is it helps people really understand what they need to do and what system is being affected. A lot of times I catch people with H. pylori infections in their stomach or Epstein-Barr, and that is what is causing their reflux or their IBS. We can also test for SIBO through another test, which is small intestine bacterial overgrowth, really easy breath test to do. You can do that at home as well. And that also helps rule things out. So those are my favorite digestive tests. And then I also really like the organic acids test by Great Plains because it looks at neurotransmitter health, it looks at gut health, it looks at infections, it looks at whole body yeast. It does so many different things as well as nutritional markers. So we get a really good overview. In my practice, my minimum is blood work. And of course, I'd like to have people send me any of their past blood work as well. So we can see trends. Is your cholesterol going up or down? Is your thyroid getting better or worse? What's going on? And based off of individual needs, we'll run specific tests. I tend to be very conservative because I understand that testing gets really expensive. So let's go with the most obvious first. And then I like to give you the list of, Alison, I have $10,000 to spend. What testing would you recommend? I like to put in order. Here's what I think is the most important, and let's just start going down the line. I retest blood work at least every 3 to 6 months based off of going on. Other people might do it more often. And as far as the other testing goes, honestly, it just depends on what shows up, because if we're seeing major changes, probably don't need to redo it. We can just keep digging further. So our goal is to define really what your body needs and understand those underlying processes. Is there an infection? Is there a nutritional balance? Is there something else that needs to be addressed? A lot of times we guess, and especially with hormones, like a lot of people will say, oh, I'm estrogen dominant, or my testosterone is really, really low, I need help, or I think I'm menopausal. And we actually find out through testing that none of those things were actually true, but our symptoms can look like different things. So it's really, really important. So in functional medicine, we say test, don't guess. So if you're reading blogs or you're listening to podcasts and you're self-diagnosing, honestly, that's a scary game to play. So don't self-diagnose and then do a treatment based off of what you think is going on. Always test, always figure out first, because if you think you have low testosterone, especially as a male, I get to say this because my husband gave me permission. He was convinced his testosterone was incredibly low. And I said, let's do a saliva test. Don't take supplements. Don't do anything until we figure this out. And what ended up happening is his testosterone was twice the value that it should have been. So it was actually way too high. So if he had started taking supplements or interfering with his testosterone, he might have pumped it up more and done damage to his body. So I'm really glad that we did that test. And for most women, we find out that what we thought is going on actually isn't. So always, 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 always do the test to figure it out. Don't guess. Don't start taking random supplements because you hope they help, okay? So treatment depends on what type of doctor you see as well. So if you see a MD or a DO who's prescribing, you might get a functional medicine prescription. For someone like me, as a chiropractor is my background, I can't prescribe. So we focus on lifestyle and nutritional support, exercise. What can we do naturally to support your body as you're going through those things? Now, of course, I have an excellent referral team that I work closely with, physical therapists, food therapists, nutritionists, and physicians, GIs. We refer to each other because you always need a team of support. I like to use the best of both worlds. And if you need medication, awesome. Let's use it and let's support your body on the way. And if you don't, you don't. And we're going to figure out what we can do to embrace that as well. So use the best of both worlds. You're never stuck. Always get a second opinion. Always get that support that you need. And if you're looking for personalized support, I would be happy to chat with you. I always offer a free 30-minute consultation and a health assessment to understand what your symptoms are, what your concerns are, what your goals are for the next few months, and then we can brainstorm on options. What type of testing do you need and what support would be best for you? So thank you for tuning in today. I'm so glad that you're here. If you have any questions, please message me. Let me know what's going on, and you can schedule online as well. So I'll drop the link to that in the comments. So have a great day. Thanks for being here, and I'll see you soon.